Welcome to TCU Pulse Check, the DNP Edition, your front row seat to the future of nursing leadership.
All right, welcome to the TCU Pulse Check, the DNP Edition, where we explore leadership, innovation, and the impact of the doctor of nursing practice.
We're your hosts, Dr. Kimberly, Posey, and Dr. Biluan.
Today's conversation focuses on policy, advocacy, and how nurse leaders are shaping healthcare at the systems level. We are joined by Dr. Serena Bumpus, CEO of the Texas Nurses Association. She is also responsible for providing oversight of related entities and programs, including the Texas Nurses Foundation and the Texas Peer Assistance Program for nurses and other programs as identified. She's responsible for executing the ongoing vision for the association as it relates to the changing healthcare landscape and the profession. Her nursing career spans over 23 years, where she's held various positions from staff nurse to nurse executive. She has demonstrated a very strong career trajectory with involvement in leadership, governance, and advancing the nursing profession. And again, the CEO of the largest professional nursing organization in Texas. She leads and advocates for legislative support towards increased funding for nursing education, workplace violence protections, nursing workforce support, improvements in safe staffing, and state-level funding for nursing scholarship and loan repayment programs in Texas. We are so glad you're here.
Well, I appreciate you giving me the opportunity to be here with you today.
Thank you, Serena. We're happy to have you here in our podcast. Serena, you've had an incredible journey from bedside nursing to CEO. What were the key moments that shaped your path into leadership?
When I started out as a brand new nurse, I didn't really know what I wanted to be when I grew up. I know that's the case for many, but I think a lot of people also have a path that they want to take, and I didn't really know what that path was. I was very fortunate in my family that, my great grandmother was a nurse. She was a nursing home administrator. I have an aunt who is also a nurse who has spent a large majority of her career in nursing leadership positions. She was a hospital CNO, and so I had those two individuals as examples. And when I started on my nursing path, I had gotten very engaged in shared governance and in my hospital. And that's really what set me on the journey for leadership. It was when I went back to school in my RN-to-BSN program where that leadership journey, I think, was really solidified for me. And even my engagement in my professional organizations was solidified for me. I was not a member of a professional association when I went through that RN-to-BSN program, but my professor talked a lot about TNA and the work that TNA does for nurses. And she actually gave us homework to tell us that if we were not members, then her expectation of us was that we joined. And I got involved very immediately after that, which I think has been another pivotal moment in my career that has set me on this trajectory for leadership, because your professional associations can help with that. And, little did I know the path that was leading me down to be here today. But those are some of the key moments, I think, that really has defined my leadership role and why I am where I am today.
Thank you for that. And so obviously you've taken on a huge leadership role in your professional organization as CEO. And can you tell us, what that actually looks like day to day in a position like that?
A lot of my work is making sure that we are not only engaging our members. TNA is we're close to having 17,000 nurses as members of the organization. I hope we hit that goal before the end of the year. But, so a lot of my work is engaging members, but also, there's a lot of environmental scanning that has to be done to really understand the issues. And, I have the privilege of being able to step out of the day-to-day minutia of nursing and look at things from a 100,000 foot view. So I see things that maybe we don't get to see ourselves when we're in the trenches working every single day. And so I can meet nurses where they're at. I travel a lot in this position, just going and talking to nurses in their communities, talking with nursing students, to truly understand what the issues are and to validate that what I'm seeing from my viewpoint is actually what's happening, and to really talk about what some of those solutions might be. So, not only do I meet with nurses, but then I also have to ensure that we maintain strong relationships with other stakeholders that support nursing or are employers of nursing, because we need those individuals on our side as well as we're thinking about what that advocacy for the profession needs to look like. So a lot of my work is relationship building in many aspects, and that includes even with our legislators at the Texas Capitol in making sure they have an understanding of the nursing issues as well, because we need them on our side too.
The member of Texas Nurse Association. I appreciate all that you do. I follow what you're doing in social media and all the newsletters today. And in fact, I have better um, view of what we're doing in Texas. There's a lot of work to do for our nurses here. Thank you very much for what you're doing. And this is just a question that I want to ask for our DNP listeners as well. Why do nurses, and particularly our DNP students, DNP leaders, need to be involved in the legislative and advocacy level?
So that's a great question. And, as a nursing profession, we definitely have an engagement issue. And that engagement doesn't necessarily just apply to those who work at the front lines. That applies to nursing leaders as well. When we think about the nursing profession as a whole and our involvement in, for example, our professional associations, less than 10% of the nursing profession in the United States are members of a professional nursing organization. So when we think about our professional associations, you have your state nursing associations, who are really the only professional association that applies to 100% of all nurses, including nurse leaders. In your professional association, because the profession of nursing is regulated at the state level, it's not regulated federally. Healthcare is legislated at the state level. Some of it's got federal regulations, but healthcare and how it's operationalized in each state is very unique to that state. And so I say that and I share that because engaging in the advocacy piece is, especially from a nurse leader perspective, this is your opportunity to not only advocate for healthcare, but it's an opportunity to advocate for the profession. We don't want someone else having a voice for us. We can use our voices on our own. We are the largest workforce in our communities, in most of our communities. Healthcare is oftentimes the largest employer in our communities. So as a profession, we have a lot of influence, or we have the potential, I should say, to have a lot of influence, but we're the most trusted and the least influential. And so that's why it's so important for nurse leaders, especially our DNP leaders, to be front and center in that engagement and involvement in that advocacy, specifically through the avenues of our professional organizations, because one, there is no better group to advocate for nursing than nurses. And two, we need to, we have the ability to be influential. But when 99% of physicians are members of the Texas Medical Association and their specialty organization, and in Texas, less than 7% of nurses are members of the Texas Nurses Association and their specialty organization, you can see why physicians are always looked to for healthcare issues, because we haven't stepped in to leverage the power of our influence yet. And so DNP leaders have the opportunity to role model what that looks like and to bring others on that journey with them as well.
Thank you for that. I think you did a great job of really, getting to that nitty gritty of why it's so critical that, all nurses and especially our leaders, our DMP leaders, to be active in the professional organizations and to have a seat at the table, right? Because
Right.
if we're not out there in front and center, then decisions are going to be made without us. So I appreciate you highlighting that. But this is also scary for people to, you know, just put their toe in the water when you say policy advocacy. Some people are like, oh no, I can't do that. That's not me. So what kind of practical advice do you have for people to do this?
And I think especially today, politics feels very icky today in 2026, and rightfully so. There's a lot of divisiveness out there, and what I would say is that nursing is not Republican or Democrat. Everyone needs a nurse. You are cared for by a nurse when you're brought into this world, and you will be cared for by a nurse when you leave this world, and you will be cared for by a nurse at a lot of moments in between there. So for nursing to really step in and to engage in the advocacy process is really, you can start very simply, just vote. I think a lot of us even shy away just from engaging in our civic duty of voting. And not only should we vote for individuals who align with our personal morals and values, but we also need to understand where they sit on healthcare issues. Do they understand the priorities and the challenges of healthcare? I think specifically here in Texas, as we look to, the entire House of Representatives is up for election or re-election this year, and 50% of the Senate, our governor, lieutenant governor, all of those positions are up for re-election. And so where do they sit on healthcare issues? How are they going to ensure that we continue to have an expanding nursing workforce and that we're retaining that workforce? Do they understand where the retention issues are and where our bottlenecks are? Do they have a philosophy on access to care and solutions? Is that solution on access to care to just continue to growing the physician pipeline? Sure, that's one thing that we need. But we also have a surplus of APRNs out there who can step in our rural communities to help solve for that access to care issue. Do they understand that? I think it's making sure that you're just engaging in that process, because ultimately the people that we vote for are the people that we have to work with to help advance our issues. That's I think one of the most important steps we can take as nurses. And again, I think this is another great way to show and leverage our influence. The largest workforce in these districts, nurses can swing a vote if they engaged, if they wanted to. I think the other piece that, for those who are already doing that and engaging in their civic duty, well, let's take it one step further now in just doing basic outreach to those elected individuals, whether that's writing them a letter and telling them your story about the issues that you're experiencing in healthcare today, scheduling a meeting with them and talking with you're not going to schedule a meeting with the elected individual themselves, likely, but you will schedule or will be able to meet with their experts and their staff who manages all of the health policy issues. And meeting with the staff is often better than meeting with the elected official, because they're the ones that are going to tell that individual how to vote or what their position needs to be. And those conversations are important because our stories matter. As an association, I can provide all of the facts and the data to support the reasons why we need to support a certain position or move a certain bill forward. But it's the nurses whose stories are backing that up That's what makes those issues memorable. So facts make us credible, the stories make us memorable, and that's where nurses can have a really, really big impact on ensuring that people are educated about the healthcare issues and the impact it has on them as individuals. But even just simply getting involved in your healthcare organization's shared governance structure. There are some hospitals here in the state who actually have an advocacy committee as part of their shared governance structure. And so for your executive leaders who are going through this program and who are, leading health systems and shared governance, this is another way to engage your nurses. Create an advocacy committee, get your government relations team in your hospital involved in that committee too, to really talk about the issues. Those organizations that have those committees actually partner with TNA specifically on nursing issues, and we work together to really advance the work and the policies that we've put forward in each legislative sessions. Those are just a few tips and tricks and tidbits that I would say this is like the most basic place you can start, is in those 3 areas to really just to start dipping your toes in it.
Thank you, Serena. That is very well explained. And this is why it's important that we need to engage with nursing organizations and associations at the state level. And I know Texas Nurse Association have a lot of resources online that they can also check. Now, going back to your leadership journey, Serena, what leadership skills became essential as you move into executive leadership?
Oh gosh. I think those skills have been refined and obtained new skills along the way. But one thing that I would say, and something that has really, since I started in my master's program in nursing administration, is something that has kind of been done every few years, and that's understanding what your strengths are. And Strengths Finder has been a great tool for me, and I now have an executive coach who is certified in strengths through Gallup, and so he uses those a lot with me. And my top 10 strengths have always remained the same, but the ones that show up in my top 5 have moved as I've grown in my leadership. The 2 that have stayed constant, though, top 2 strengths, which is strategic and futuristic. And so when I think about those skills, and my family, you can ask my husband this, because I'm always thinking ahead. I'm not really thinking about the impact something has now, because I was there like 3 months ago. I'm I'm looking ahead to, if we do this today, what's the impact it's going to have 5, 10, 15 years down the road. That is something that I've always been really good at thinking about. And I think as nurse leaders, we need to be thinking ahead into the future. So we have to start taking a more proactive approach rather than a reactive approach. And I think in healthcare, it's much easier to be reactive because it's such a complex system that we work in. But the more that we can be proactive and think ahead into the future and be strategic about how we then approach things, whether that's in a stepwise motion or, we're going all in at once, that's, I think, that change management piece is really important. So those are kind of the 2 big things that I think about from my own leadership skills that have really helped me move through my leadership journey and sometimes even be further ahead than others. And I have to remember that I need to kind of walk a little slower than others so they can get on board with me. Because I don't want to leave anybody behind. And so I have had to be very intentional, because my other strengths are activator and maximizer and achiever. So you can imagine that combination can really start to get ahead of itself. The other skill that I think that is really, really important as leaders is we have to be good listeners. I do more listening in this role than I have ever done before. And it has proven to be one of the best skills that I have, and looking back in other leadership positions that I've been in, I can pinpoint the moments where I wasn't listening, and how I could have potentially changed an outcome or even a relationship had I just listened a little bit more. So that in and of itself is probably the most important skill you can have as a leader.
Thank you for that. And I loved hearing you say about being futuristic. I think that is a really excellent skill to have. And we right now, as you say, you've already here, and we know about the burnout and the workforce issues. But if you put on that futuristic lens that you like to have, where are we going? What needs to change? Where do nurses need to kind of set that North Star, or how to kind of reset? Can you speak about that a little bit?
Yeah, I think here in Texas, our elected officials have really done a great job in supporting and ensuring that we have the dollars from our Texas government to increase the pipeline of nurses. Our schools of nursing have really done a great job of expanding their cohorts and their new grads. We can't forget the other side of that, though, which is the retention piece. So our faculty are working really hard to produce the best new grads they can produce in their programs. And we don't want to lose those individuals within the first 5 years of their career, right? And we are still seeing that we're losing about 40% of new grads within that first 5-year period. And so when we think about the fact that our tax dollars are being used to produce more nurses to help increase to help support the demands that we have here in Texas, we have to be very intentional about ensuring that we're not wasting those tax dollars. A couple of things that we're starting to look at is, there's really 8 dimensions of wellness. It's not just physical and mental wellness anymore. It's financial wellness, it's environmental, it's occupational. And so all of those components need to be rolled in together. And so we've, from a financial aspect, we have secured money from the state to ensure that Texas has its own nursing loan repayment program. We have $12.5 million appropriated to that. And, nurses who have been working in the state for at least a year and continue to work in the state can apply for that loan repayment assistance. And, for a registered nurse, they can get up to almost $9,000 of their student loans repaid. Advanced practice nurses can get up to $30,000 of their student loans paid. So from a financial wellness perspective, that's pretty incredible. Mental health, the same thing. Psychiatric mental health nurse practitioners can get up to $60,000 of their student loans paid. We have nursing scholarships that are distributed through the state. And so those are some of the things that we have started to look at. But, one of the things that we still have a challenge with is workplace violence. It continues to increase, and we have legislation here in Texas. We have our Workplace Violence Prevention Act, and then, it's now a felony to assault a healthcare worker on hospital property. But we still are seeing those incidents increase. And so we're starting to have conversations with our hospitals, with the CNOs, to just understand what is working, what's not working, what else do we need to ensure that nurses walk into a safe environment every day. Because we still have a big uphill battle, I think, to tackle with workplace violence prevention. Staffing continues to also be one of those things that we look at, and we've had staffing legislation here in Texas since 2009. We will fully implement the revised staffing legislation. It has to be fully implemented by September 1st. And so we'll need to monitor what that looks like and the impact it's having to then decide if we need to pursue other options related to staffing, because that is one of the top reasons why nurses are leaving the profession or their hospital organization.
Wow, such vital work for our Texas nurses. Thank you very much for everything that you're doing. You've hit all the points of, the importance of focusing on retention and staffing and ensuring that nurses get education and have fundings to get those education as far as advanced degrees are concerned, and even, doing their RN program. Thank you very much for all you do. And to add to my question earlier, how did your DNP degree or DNP preparation influence how you lead today?
Hmm. Gosh, you guys have had some really great questions here. So, I would say that I was very fortunate in my DNP program to, again, get a lot of those assessments that everybody likes to do, the Myers-Briggs and the DISC and, those sorts of things. It's always good to have, more insight into who you are and how you function as a person. It just raises your own emotional intelligence. So you are better able to read the room and interact with others. And so I think that in of itself has helped me a great deal. But and I think each program does their DNP project or their capstone a little differently, but I had to do an actual project and implement it and report out on the results. And my project was actually on nursing peer review. And I was consistently hearing that nurse leaders weren't implementing peer review, or they didn't understand the peer review process. And so I did an assessment of their understanding to help inform, how TNA could actually move forward with educating our nurse leaders across Texas. And it's your DNP project is yours. And someone else can, carry on the work that you started, but in a nutshell, it's your legacy to some degree that you have the potential to lead. And so I was very adamant when I went into my DNP program that I did not want to do a project in my organization. I wanted to do something that was going to be bigger than my organization, to make an impact on the nursing profession. And so that was my start to that, and it helped inform what TNA has now created nursing peer review workshops to help educate nurse leaders and peer review committees on how to do this inside their organizations. Had peer review legislation specifically around safe harbor changed to allow a nurse to invoke safe harbor orally versus having to go through the whole written process. I know that the question was more so how the DNP has impacted my leadership, but I think, those projects really have a huge impact on your leadership and your role and the legacy that you leave behind as a nurse. And it will carry with you, and you get to continue to grow it and be the expert in that area of study. And so I encourage all DNP, potential DNP nurses to really think about that project and what they want to do that is going to leave a lasting legacy that they can continue to carry forward. It's not a box that you just check.
Yeah, I really appreciate you saying that, because, the evidence-based practice and quality improvement, that is the bread and butter of a DNP, right? And I think you highlighted that really well, and how those projects have, you know, changed a huge state organization that you're leading. And like you said, continuing on those positive changes for peer review. Yeah, what a great project.
Thank you.
And I think it is important that our listeners out there who are thinking about DNP programs or are in one, about the project is not checking a box. I love that. That it really does make a difference with that. I, appreciate all of your time, that, sharing with us so much about your executive leadership pathway transition from I think I heard you say an ADN all the way up to your DNP. And it's been an amazing journey to listen to what you have done and the impact that you have made for Texas nurses. It's really amazing.
Well, thank you. It's very humbling to be in this role and to have the opportunity. It's a privilege to be able to advocate for nurses and to engage with just a multitude of different individuals across the state. So it's been a lot of fun and something I definitely don't take for granted.
Thank you. And for our listeners, thank you for listening to TCU Pulse Check, the DNP edition, your inside look at power, purpose, and the pulse of the DNP.
And be sure to subscribe, share this episode, and stay connected as we continue to highlight how DNP prepared nurses are shaping the future of healthcare.
TCU Pulse Check, the DNP edition, takes you inside the heart of advanced nursing leadership, innovation, and impact. Hosted by DNP faculty Dr. Kimberly Posey and TCU DNP graduate and innovator Dr. Paul Biluan, this podcast explores the evolving role of the doctor of nursing practice in shaping healthcare systems, driving policy, and transforming patient care. Each episode features conversations with nurse leaders, faculty, students, and alumni who share their journeys, insights, and lessons learned along the way. Whether you're a prospective student, current DNP, or a healthcare professional, join us for authentic discussions that spark ideas, inspire leadership, and keep you connected to the pulse of nursing practice.